Paterson Building is one of Europe's leading cancer research centres. There's over 700 scientists and clinicians working in this building, trying to discover new areas for cancer research. What the new building does is it enables that day-to-day interaction between clinicians and scientists. Ultimately, the ambition is for us to double the number of patients in clinical trials by 2030.
I'm so excited about this building because it'll really generate novel clinical trials for our patients. And that will include trials that will prevent cancer, trials that will actually give precision treatments with novel therapies, including targeted therapies and immunotherapies, but also trials to prevent the side effects of therapy for those that are living with and beyond cancer.
The drugs that we tend to be testing in the clinical trials are targeted cancer treatments. So they're either treatments that seek to exploit weaknesses in the cancer cells, or treatments that seek to use the power of the immune system to attack cancer.
We are working at comparing different recipes to see which one will be able to detect better the fingerprint of a cancer that we can see in our blood, in the plasma.
The Surgical Research Hub here is very unique. I can't think of any hub of its kind elsewhere in the UK. The aim of the hub is to change practice through trials, to innovate and develop new treatments, and ultimately to guide how things are managed in large healthcare systems like the NHS, in patients who are having surgery and undergoing anesthesia.
Often when we think about cancer research, we might think about fancy labs and complex clinical trials, but there is a lot of research that can happen on the data we generate as part of our daily practice in a hospital. So at the Paterson, we are opening our clinical outcomes in data unit. So really is the first time we bring all these teams together with one single focus, which is this is the data we are producing. How can we best use this data to raise questions, to improve the care for our patients?
Hi, Mark is it? Really nice to meet you. I'm Nick Jones. I'm Director of Strategic Initiatives here at the Manchester Cancer Research Centre. I kind of oversaw the development of this new building. So I know you want to hear about the research that we're doing here, so it'd be great to show you around. Okay, Brilliant. Let's go.
My name's Mark Steele. 7 years ago I was diagnosed with stage 4 cancer. I was given 6 to 12 months life expectancy. Then I was offered a clinical trial. 7 years later, I'm here in good health.
So we're now in the heart of the building and we're in the biomarker centre, you know, one of the best in the world, really.
What is a biomarker? I don't quite understand it.
Yeah, so a biomarker, it can be a protein, piece of DNA, metabolite, which will give us a lot of information. For example, it can tell us whether a treatment is working or not. It can help us to detect cancer at a much earlier stage. What's great is, you know, we have the Christie there, and right over there we have where the scientists are kind of interacting with each other and analysing their data. And, you know, the close proximity really helps. It helps to promote interactions, which is all about team science, really, working together for common goals. And that common goal is to develop better treatments for patients.
So complicated, cancer, but these are dedicated people and dedicated machinery. It's moving forward, not backwards, but moving forwards. I feel really lucky to have this on my doorstep.
There's nothing better than being in a building in which science is translated to hope for our patients, to take us into the next era for Manchester and for cancer research in Manchester.